My name is Brittany Rose, and my ethics debate question is, should everyone have access to health care regardless of their ability to pay? First off, I want to ask you, have you ever been sick? Have you ever been in the hospital? For most people, this is a very scary time because not only are they worrying about their illness, they're worrying about how they're going to pay for this bill. The one good thing that Obama, when he was in office, came up with in March of 2010 was the Affordable Care Act, also known as Obamacare. The Affordable Care Act has expanded health coverage to upward of 16.4 million uninsured people. Although this has brought needed health care services to millions, it has also brought new access challenges to the U.S. healthcare system. Emerging affordable healthcare programs create expectations for more convenient access to care. So with this, who needs to pay? Is it us? Is it the government? So should we get it for free? Some of the things the Affordable Care Act, I want to kind of explain to you and give you a little meaning of that, is they've tried to, hire different providers and have more providers in different offices to kind of help with the growing Obamacare. Well, there for a while that worked, but then they realized that many of the providers was leaving because the pay they was receiving was less. Another thing they have tried is expanding clinic hours, including weekends and evening hours. It worked for a little bit, but then it got to the point that the clinics was overbooked, the doctors were underpaid, and it just didn't work out. Also, another innovative model that they tried was to try to work on appointments instead of making them at the time of the rounding up of the end of the office visit. Instead of making the appointment then, just telling the patient to call back when they needed another appointment and set up the appointment then. That actually worked really good for a lot of people, but then it also had parts that it fell through the cracks. All these things had their pros and cons, but as more and more patients seek access to primary care, the strategies began to alter. And there are a growing number of patients who also expect that care can be provided without an office visit. So like if you're getting tests done, they wanted to have the test done but not see the doctor. And that can't be happening because that's why you see the doctor, is to see if you have any new issues. Expectations for the primary care doctors are growing, and as are the challenges we are facing in meeting them. In seeking to provide better access, quality, and improvement patients experience at a lower cost, we got to meet in the middle on who's got to pay. So, also, while we're going over the Affordable Care Act, I'm also going to tell you a little bit about the different plans. We have what we call managed care, currently the dominant health care delivery system in the U.S. Managed care seeks to make individual health care as efficient and cost-effective as possible. Different managed care organizations have different definitions of essential care, and accordingly, coverage and costs vary widely. Often there are restrictions on whose members are more covered by different parts. And that's where your HMOs, your PPOs kind of come into play. Who you can see in network, who you can see out of network. You then have Medicaid, which is a taxpayer-funded government program that provides health insurance to low-income individuals and families, such as pregnant women, such as children, such as the mentally handicapped. Medicaid, though, is administered differently from state to state, so the qualifications differ. Another big one is Medicare. Medicare is a taxpayer-funded government program that provides health insurance to the elderly and disabled persons. You have 4 parts. Within your 4 parts, it goes over Part A, which is the hospital insurance, Part B, which is the medical insurance, and Part C incorporates health plans offered by private health plans, and Part D is your prescription plan. Then you have multiplayer. A healthcare system in which healthcare costs are paid for by multiple entities, often including public and private contributions, as well as tax revenue. Another thing is single payer. A healthcare system in which a single entity pays the cost of the healthcare in a whole. Then we have socialism, which is an economic and cultural model that aims to provide everyone with equal access to basic human rights. Then we've got Social Security, the largest government-funded program in the world. Social Security is a program funded by payroll taxes that provide benefits to retired, disabled, and widowed Americans. Now that I've kind of gave you a little information about different healthcare plans and about Obamacare, how it came into effect, my next thing is a lot of Americans compare us to Canada because Canada is known to have free healthcare. But is it free? Well, the first question is, what do you define as free? Canada's healthcare is funded by a single payer, which we just went over, system, but it does not function as one single unified system. Coverage is publicly funded, meaning that the funds come from federal taxes. Some estimate, such as those as the Fraser Institute, put the average cost of about $5,789 a year per person, meaning Canadian healthcare is not free. Additionally, care is provided by plans created in each province or territory. So, truthfully, United States and Canadian insurance is not that much different. They have their pros and cons of both. For example, all necessary health services in Canada, like surgical dentistry, hospitals, and doctors, must be insured by the public plan. And such public plans don't cover such people like immigrants, visitors, so that there's a lot of cracks or gaps that them people can fall into. The next thing we will go over is Canada in general has, their providers and our providers. Their physicians are private providers rather than government employees. Ours is government employees, whereas they pay into the taxes and everything. Those providers see patients and charge insurance plans just as they do in the U.S. In this instance, Obamacare versus Canada Healthcare Act really ain't that big of a difference. My thing, though, is, back to my question, should we all get free access to coverage no matter our ability to pay? Because you have people out there that want a free ride, but then you have Americans out there that need health care. You have the elderly, you have the children, everybody in between, all that need health care and don't get it because they're not able to pay for it. Couple of pros and cons that we look at is, one of the pros is instituting a right to health care could lower the cost of health care in the U.S. It could. But also, the con to that is a right to health care could increase the U.S. debt and deficit. And the U.S. is in enough debt as it is. Another pro is a right to health care could save lives. The con to that, a right to health care could increase the wait time in medical services. So if you have an appendix that busts, you're going to be waiting longer periods of time to get that fixed. Whereas if you are providing and paying for your own insurance, you would be seen quicker. Another pro is the right to health care is an internationally recognized human right. The con to that is implementing a right to health care could lead to the United States towards socialism, which I explained earlier in the discussion. Another pro is a right to health care could make medical services affordable for everyone. Sounds great. But the con to that is providing a right to health care could raise taxes. And as it is, in our area, so many people are under the poverty level that they can't even afford their taxes now. If we was to raise this, how are they going to afford them then? Another pro is the right to health care could improve public health. Yes, but the con to that is the right to health care could lead to government rationing of medical services. So if you go in to have surgery, that if they're rationing what they have, there's chances are you couldn't have that procedure done. And that's something that could have been medically necessary. Back to my debate question. Should everyone get free access to health care coverage, no matter their ability to pay? As for me, I pay in the insurance. My family pays in the insurance. But I know plenty of individuals that do not have the ability to pay even the $5 or the $10 or $20 copay because they are lucky to even make enough money to afford that. So, in my conclusion, I would say that America we don't need to be like Canada, but we do need to find something that is affordable, because Obamacare in some instances is affordable for some, but in some it is still outrageous, the prices of it. We need, as Americans, to come together and find something that works for not only the wealthy, but the poor. Meet in the middle and come up with a plan that helps each and every one. Because nobody should have to die because they didn't have the ability to pay their bill.